I'm Brittany Lewis with Forbes Breaking News. Senator Roy Blunt questioned Education Secretary Miguel Cardona about mental health in schools during a Senate Appropriations Committee hearing on Tuesday. The Education Department's fiscal year 2023 budget requests $1 billion to increase health professionals in schools. This includes counselors, psychologists, and social workers. Blunt told the secretary that the money available to schools through COVID pandemic relief should have been used for mental health. The secretary reaffirmed that funds are also being used for that purpose. Listen in to the full exchange.
Thank you, Chair. Secretary, as you know, one of the things that I've worked on hard, and this committee has too, is getting in a situation where we treat mental health like all other health. The department's budget requests $1 billion for a new program to increase the number of health professionals in our public schools, including school counselors, nurses, school psychologists, social workers. In the budget year we're in now, we provided $111 million for that purpose, which was an increase of $95 million over the previous year. Can you give me an update on what you hope to do with that $111 million and how quickly you think we're going to begin to see some results in terms of people available to fill the need you see in schools for these professional services?
Thank you, Senator. And first of all, thank you for your service over the years. This is your last hearing. Thank you for the advocacy on behalf of our students.
Thank you.
Mental health has to be significantly greater in how we educate our students moving forward. There were issues with mental health access before the pandemic. They're much worse. I'm pleased that with ESSER funds, there's been a 65% increase in social workers, 17% increase in counselors. But in my conversations across the country, it's not enough. We need more. And there needs to be long-term funding to make sure that these resources are available for the long term. And you're absolutely right. There is a shortage of school social workers and community social workers. In our budget, we have funds aimed at promoting a partnership between higher education institutions and K-12 institutions to make sure that we're producing social workers. And we hope to fund programs like that with these funds so that students have access to the supports that they need. Additionally, mental health support also includes access to after-school programming or engaging with a mentor or having other activities that give students an opportunity to engage in a positive social climate with their peers. So addressing mental health supports does include increasing social workers and access to community providers, but it also means increasing access to positive peers for our students.
So, Mr. Secretary, the money that was available to schools through the COVID pandemic relief, I think that money could have been used for mental health, maybe in the way you just defined it. Do you see schools doing that? And if they're not doing it, why do you think they're not using it for those mental health purposes?
Yes, sir, I do see them using it that way. A Future Ed report confirmed that a high percentage of staffing is aimed at providing more mental health support. I do believe that they're using it very well. I've seen examples. I remember visiting New Mexico recently and having a circle with about 15 to 20 students, high school students who were really affected by the pandemic. At least 2 of the students in that circle lost a parent during the pandemic. And one of the students said the only reason why he's back in school is because of that counselor that brought them back over the summer to connect with them, and the student is doing better now, but he said if it weren't for those supports there, he would not be in school. I've seen it firsthand, and I know the money is being put to good use, not only with additional social workers, but with programs that reconnect students that have been disengaged or family members that have been disconnected from our schools.
Well, I hope we're encouraging them to use this money that way and to use it in the near term rather than some program way out there, because just like you said, I think the disruption of in-person school and other things has created some significant challenges we didn't have before. I'm very concerned. There are recent news reports that data from individuals completing their free application for student aid was shared with Facebook through the Meta Pixel code. Could you talk to me a little about that? I think initially the department did not think that happened, but Richard Corderay, the student aid chief operating officer, said it did happen. Could you talk about that?
Sure, yes. What we found was in May 2020, during the last administration, the department inadvertently activated a more sophisticated advertising tool that did share some information, but not social security numbers, dates of birth, or personal financial information. Once we found that out, we immediately stopped that feature, and we're moving quickly now to investigate this and find out what was shared. And we plan on, we had two congressional update meetings already, but we plan on being very open and transparent about this information.
Well, I heard you mention May 2020. Let me just, to finish my thought out here, Corderay says it was inadvertently shared after FSA engaged in a March 2022 advertising campaign, and it came out later that that information was shared with Facebook as early as January 22. It could be there's also a January 20 or May 20 situation, but I think there are clearly situations in the current year where this material was faced. Thank you, Chair.